Well, good morning. I want you to just do something very quickly. Say good morning to the person next to you if you hadn't done that already. Well, we're all very excited to be here. My name is Dr. David Hampton, and I am the newly appointed Executive Director of LISC Indy. I want to thank you for taking time out of your busy schedules today to attend this press conference as we celebrate the 8 communities who applied to be a part of the initiative and announcing the community selected to receive funding through the Equitable Food Access Initiative. I'd like to step back and just talk about the why. LISC Indianapolis is committed to addressing racial and social determinants of health through investing in the people and the places within our city. We believe that where you live shouldn't determine how long you live. Approximately 80% of what determines a person's length and quality of life really happens outside of the doctor's office, outside of the clinic or the hospital. We're focused on supporting community stakeholders as we build together great neighborhoods. As both a major employer as well as one of the largest health insurers in the U.S., Anthem engages with partners to make a major impact on hunger and food access, as well as differentiate itself as a valued community and business leader, in part through its social determinants portfolio focused on food. We are grateful for Anthem Foundation's commitment to addressing food access in Indianapolis neighborhoods, and we need solutions that not only directly impact food insecurity and improve healthy food access, but also support economic mobility, racial equity, and community resilience. I would now like to introduce to you Dr. Shantanu Agrawal, Chief Health Officer with Anthem. Dr. Agrawal.
Thank you very much for having me here. It's really wonderful to be here. And let me just say, I get to be the voice for just a really excellent team at Anthem, both at Anthem Incorporated as well as the foundation. And it's really in their name that I get to stand up here before you today and make a few comments. It's really wonderful to be here, despite the heat and humidity. I hope you are enjoying the event and going to learn something from it. And it's really great to meet all of you this morning. And I look forward to spending a little bit more time with you. For more than 75 years, Indianapolis has been Anthem's home, a community where our business has grown and where our associates live, work, and raise their families. At Anthem, we have maintained an unwavering focus on making a difference in Indianapolis and in all the communities we serve across the United States. On behalf of my 5,000 colleagues based here in Indiana, thanks for having me and thanks for being here. Our partnership with LISC really began in 2019 when Anthem conducted a listening tour to better understand specific challenges to food access in Indianapolis and identify ways to address both short-term needs and create long-term solutions. And now today, we are pleased to share this next step. I'm an ER doc by background, and I've seen firsthand the impact of social factors on people's lives. What does it mean to prescribe somebody an antibiotic if they don't have food to eat at home? Those are the kinds of issues that we desperately need to address. Anthem is deeply focused on addressing the drivers of health, like food insecurity and the inconsistent and insufficient access to nutritious food that affects the whole health of individuals and entire communities. Just last week, we announced the continuation of our national partnership with Feeding America called Food is Medicine. Locally, the program involves Eskenazi Hospital, in which healthcare staff conduct food insecurity screenings and partner with food banks. Gleaners is our local food bank here in Indianapolis, to intervene appropriately. The inaugural Food is Medicine initiative has screened more than 91,000 patients nationwide so far. Food insecurity is actually the most commonly reported unmet social need in the United States. Now take a moment and think about that, given who we are as a country and how successful we are in so many ways, financially and otherwise. And yet food insecurity is one of our core, basic, and unmet social needs. 40% of households report moderate to high levels of food insecurity, and as you are probably all aware, it's only gotten worse during this pandemic. It is estimated that 2 out of 5 food bank visitors in the last year are people experiencing food insecurity for the first time. The impact of all of that is felt in every community across the country. But the crisis is far worse than certain communities, with disparities often miles apart. We are the ASK initiative because it's an approach to a widespread problem viewed at the most local level, where the residents of a neighborhood have a voice when it comes to developing and implementing real solutions. This is a complex area. I urge other organizations in Indianapolis to join us and partner with the residents of Indy neighborhoods to invest in long-term solutions to address equitable access to food. Again, thanks for being here and thanks for listening. Appreciate it.
I'm pleased to introduce our next speaker, who is a friend and happens to be the mayor of the great city of Indianapolis. Let's welcome Mayor Joe Hogsett.
You know, for all of you that are standing out in the sun, I have such admiration. And I'll try to be brief. This is an important day and an important announcement. Before the onset of the pandemic, it's not that hunger and food access and insecurity in Indianapolis were not an issue. They were. In fact, it is estimated that 1 out of every 5 Indianapolis residents, Marion County residents, were affected prior to the pandemic. As the result of that onset, that number is now closer to 1 in 4. That's why today's initiative is so important. And it has so much potential to impact hunger. As a 3-year commitment, it will be a sustainable boost to solving this persistent public health challenge. And as a city administration, we've centered food access as a major priority. That's why in January, we created our city's first ever Division of Community Nutrition and Food Policy, while also establishing a new commission and an adjacent coalition to address healthy food needs across our city. The new division is tasked with addressing racial inequity in our food system, creating food policies and programs, and reducing food insecurity in Indianapolis, all the while with an emphasis on food deserts and underinvested and underappreciated areas. As the division's first director, Malele Kennedy has sought to coordinate existing efforts and ensure solutions come from those who live, work, and eat in the areas that we serve. That includes things like the Neighborhood Food Champions program, which frankly is designed to empower neighborhood leaders to leverage their intimate knowledge of their neighborhood to help supply and produce innovative projects that feed residents with affordable and nutritious food. It also includes investing in the Indy Local Grocers Coalition, which increases access to nutritious food while supporting the backbone of our city's economy, local businesses. One thing's clear. There is no one solution to food access and food insecurity. It does take all of us working together in tandem, and it takes efforts like this partnership between LISC and the Anthem Foundation. Those partnerships are critical, along with the 8 communities who applied for this funding. Those 8 communities are doing some of the most important work in Indianapolis today. Work that can and will create real and lasting change. I am convinced more than ever before that together we can reach the common goal of a more equitable, more accessible, more nutritious, healthier food system. We won't stop until it's done. I thank you.
Thank you, Mayor. I'd like to thank the Equitable Food Access Initiative Advisory, a diverse group of food, healthcare, community engagement, and development professionals who gave many hours to review each proposal. They helped to identify strengths and opportunities and select the focus investment community. To represent that esteemed group, please welcome Dr. Jasmine Gonsalvo.
Through collaboration with a diverse advisory composed of healthcare representatives, residents, food experts, community engagement professionals, and public agencies, LISC Indianapolis facilitated an open and inclusive neighborhood selection process. Early on in this process, LISC Indianapolis hosted a community training on how to submit a collaborative response and a community information meeting to present the details of the initiative. 8 Indianapolis communities self-selected for this investment and collaborated with neighborhood partners to respond to the RFP, highlighting the needs and assets in their communities, their approach to improving health and food access, along with environmental and social impacts. These 8 communities have dedicated a lot of time and energy to this process while continuing the important work that they do every day in their communities. Just this morning, I was working in an Eskenazi clinic in another part of town, seeing patients with severe cardiovascular disease, diabetes, high blood pressure, and high cholesterol. The work of these communities towards building healthier food systems and improving access to nutritious foods is so critically important at addressing the upstream contributors to so many chronic diseases. I'd like to spend a bit of time highlighting their efforts and a few of the strengths that each community presented through their proposals. Southeast Neighborhood Development Incorporated developed a proposal that truly embodied inclusion and engagement with communities who are often overlooked, with particular focus on immigrant and Latinx communities to address immediate and long-term food access needs. The deep connection between social service and community development partners was evident. The Near Northwest and Flanner Houses proposal reflected a strong commitment to food and social justice, with a clear plan and vision for active projects demonstrating how a food system becomes an economic engine for residents. Their efforts are a great example of how to contextualize food access efforts to the specific needs of their community. The Far East Side and Mount Carmel Baptist Church's proposal showed a willingness to build new collaborations and deepen existing partnerships. They had a strong desire to build neighborhood and nonprofit organizational capacity to leverage much needed investment in all aspects of the social determinants of health. They were led by impassioned voices of the community, including Counselor Lakeisha Jackson, who has been a fierce advocate for her neighborhood and Indianapolis as a whole. The Mid-North Midtown Indianapolis proposal had a great balance of grassroots organizations, city programs, nonprofits, anchor institutions, as well as government agencies to begin building connections between the integral food system elements. This community expressed a genuine appreciation for the process of proposal development, moving from silos into more collective discussion and shared vision around food access. The East Economic District and Edna Martin Christian Center's proposal described good collaboration across most of the Near East Side and Southeast communities. Leveraging the organizational capacity of strong community service and community development organizations. They focused on developing food-focused entrepreneurs and food system job creation. The Northeast Corridor and United Northeast Community Development Corporation's proposal reflected a deep community connection and trust with resident stakeholders. They focused on catalyzing growth by leveraging their relationships and assets that exist in the community with a multi-generational approach supporting improved nutrition and locally grown food in schools, connecting youth to urban gardening programs, and cultivating social connection for seniors through community gardens and other food programs. Their proposal described their strong desire to develop a food system that supports family-sustaining employment, resulting in economic mobility and community growth. The West Indianapolis Development Corporation's proposal included collaboration with 2 adjacent communities and a strong corporate presence, all coming together to build a vision of a food system that addresses food access in both communities. They developed a competitive proposal suggesting a strong framework on which to begin project development. The Near North IU Health District's proposal built a strong vision to address food access on the momentum of other development happening in the community. The proposal was strong in elements of sustainability, involving a wide array of other projects, grassroots collaborators, and investments. The development of the IU Health District will bring positive impact on the surrounding community, improving food access through that comprehensive investment. The selection and process included the review and scoring of each proposal by the advisory members according to the criteria identified in the RFP. Upon collective review of the proposal, the top 4 applicant communities were invited to interview. An advisory subcommittee completed interview and scoring for criteria related to food systems knowledge, organizational and community capacity, and impact. These collective scores were presented to the advisory along with the initial scores and ranking from proposal review. With the help of a community needs story map presented by Keep Indianapolis Beautiful, the advisory considered community need in addition to proposal criteria and interview performance. Our advisory group had a robust discussion and difficult decision to make amongst these thorough and impressive proposals, impassioned interviews, and picture of need. I'm so pleased to announce today that the Northeast Corridor, in partnership with United Northeast Community Development Corporation, was selected for this unprecedented investment. This community will now start a community-based planning and implementation process that convenes residents, community leaders, subject matter experts, and civic organizations to develop a vision of equitable food access, coupled with strategies for physical developments, programmatic partnerships, and investment to achieve that vision. This includes determining which food projects will be supported, launched, or expanded. Emphasis will be placed on ensuring all projects improve food access and economic mobility for the neighborhood, community-led, and help build racial equity. Let's give a round of applause to the Northeast Corridor in partnership with the United Northeast Community Development Corporation. It's now my pleasure to introduce you to Ashley Gervitz, Chief Executive Officer for United Northeast Community Development Corporation.
Well, good morning to everybody. Thank you, thank you, thank you. To Anthem, LISC, Mayor Joe, President, Director, Dr. David Hampton, thank you all, and to the advisory for seeing that of the collective things that day in and day out, as we try to keep hope alive, you really have set the tone of us now being in another step in the right direction for food sovereignty. Now, I'm going to keep it short here, but while I'm standing here, this is not a unique thing. This is a community thing. And what does community mean? We break it down into the fundamentals of what community stands for. It's learning to communicate that of the needs that are happening here within 46218, 226, 235, 205, NFR. It's also, too, seeing that if we can create the right system and unite, just imagine the amazing potential of seeing change occur within our own backyard. And yes, hallelujah to that. And we're going to give another hallelujah to that as well. Yes. But before we kind of break into what our appreciation is and what this investment will actually do, it's very important to realize as United Northeast Community Development Corporation, this was founded in 1999 by the residents. At the time, as a community, was experiencing other systematic barriers with our school to prison pipeline, the drug epidemic that hit this corner. As you see today, this is what can come and make beautiful if we all come together. This facility was designed with residents that come to mind. This community as well, with the right partnerships of not just our private, but our government, our residents, all sitting at the tables together, no matter our differences, but to see that we can make better access. And so with this initiative, we're very excited to see that as United Northeast holds on to the overall quality of life plan for the area, one of our very first steps is to take what we experienced and what was really revealed, especially during COVID, where we finally could see with the Band-Aids ripped off who all was really hurting, and that was everybody. To learning about my new craze of cooking and getting my fresh herbs from Miss Joyce's Elephant Garden with their generational family support. 3 generations right at 33rd and Sherman. Y'all, I have the best sage and parsley that I whip up in my little foodie dishes, you see. So please make sure we see that of the connections there. To the MLT Mentoring and Outreach, where their power of partnership was seeing that not one door be knocked, but over 350 doors in 4 hours be knocked. And that generous support of Anthem that was there, that's 350 households. At least we know for one day that they had the adequate food. But imagine the magnitude that every day that there's no worry about food. That every day with that knock, that while we may see that someone may have an access to food issues, that we're making their whole life as whole as possible because we're all coming together and filling in these gaps together. Also, to look into the new lens of innovation, and not to put them on the spot, but I told y'all got to be ready. If our youth can stand for me, please. Yep. The work we do as a community, we do for you, and we're going to always do it with you. You are our future, you are our light, and you do not have to go outside this neighborhood to see just how great you are. It's our goal with this initiative to know that the seeds you are planting today, that you are going to be able to give that to the next. So I want to say thank you for that. Now, you got your 30-second elevator speeches ready? You're next. I'm just kidding. No, just kidding. No speeches. But, again, we do this for our youth. And I also just want to take a moment from a historic aspect to see that we're making systems change. Who would ever thought that in the late 50s, that this was a family that owned this property, the Roberts family. They were dairy farmers, made the choice of increasing their generational wealth to sell land. And one of the first investments was actually creating a residential community. If you know where there are people that are gathered, they're going to need food. With food means creating that of an ecosystem that they built together. So no matter the barriers that come, we know it's been done before, and we know that greatness will always come to way if we find that we put, again, our differences aside and focus on the good and bring our gifts to the table, that we can make the policy changes with the great work that the city's doing with the new council and our policy work that Malele is overseeing with the directorship. Continue to expand on the quality of life plan that we've seen firsthand, also with the social determinants of health with the Diabetes Impact Project. We can increase our lives by the food we eat. We can increase the mental health and well-being of one another by the times and experiences we share, but most in particular, because of these gracious donations, these are some of the things that we as a community seek to do. One of the first things is taking our quality of life plan, which as a community, this is our blueprint to make sure we all keep a shared understanding and commitment. You can do your thing, but let's make sure we stay to the core of what we all have come to a consensus to do together. That means we'll be creating another pillar specifically about equitable food access. So that's a major thing. So the work that is already in play, which includes seeing that be now the first stop for food champions like Michael and Marcus. They're at work. They send their regards, y'all, as they are training for their store. But that we all have that one pillar of how we prioritize. Another thing that comes into mind is how this food hub, while it's great we can have a physical place that we seek to provision, but there can also be that of the data connection and helping the next generations to come of having a digital interface. So maybe as we're continuing to go knock on the next set of doors, right at the palm of our hand, we can actually now see that we're getting people registered with maybe the access barriers of WIC, FreshBucks, helping the small store grocer that maybe is looking to get their next product on the shelves, seed the store. We can all do that if we all be innovative together. Other projects in mind also include getting a mobile unit up and going, which was a birth idea of our youth sitting right in front of us at MLT Mentoring and Outreach. And also too, the food and the harvest, it's a great parallel as to where we are today, that our whole goal will be that our early learnings of entrepreneurship, the healthy foods we eat, can now be bought in a store within our own neighborhood. Now, I would be definitely remiss to say that we are truly, truly thankful as a neighborhood that we are one step closer of having that catalytic change to see our neighborhood be food sufficient. But if one's hungry, we're all hungry. And I want to make sure as a community, and we've all come to the consensus of this, the love that we share as a community is an extension to every neighborhood across the city, so that no matter where the application is, that we can always be the epicenter of always being a good neighbor, standing with you all as one together. So with that in mind, thank you all again for the investments. This is something we accept and we're accountable for, and we do look forward to, along the way, letting you see the successes of the seeds financially that were invested, emotionally invested, to make sure we continue to see the good continue to grow here in Northeast Indianapolis. Thank you.
Congratulations again to Ashley and the United Northeast Community Development Corporation and the residents of the Northeast Corridor on this very exciting opportunity. I want to again acknowledge and celebrate really all 8 communities that collaborated to submit through the very thoughtful proposals. The caliber of the proposals we received proves that Indianapolis neighborhoods are primed for investment when it comes to addressing food access. I want to give a nod to Brandon, who I see. I saw Lisa Laughlin here. Yeah, let's give a hand to the leaders of our community who really make up this ecosystem. Although this funding is an investment in a community-driven plan for one Indianapolis neighborhood, the initiative is built to be scaled to additional neighborhoods as additional capital is secured. So anyone listening to us today, and you have a philanthropic ethos and mind to give, we'd certainly love for you to consider contributing to this great initiative. We appreciate the partnership. I want to thank Anthem Foundation and this remarkable investment in improving food access in Indianapolis. Let's give a hand to Anthem as well. And I'd certainly be remiss if I didn't recognize the LISC team and staff. Shelby Cummings worked very hard, so Shelby, kudos to you. Thank you to Megan Bala, who is our communications director, and she helped put all of this together today. So we thank you. And I see Emily Scott back there and Sean Thomas. I haven't even met most of my, half of my staff. So Sean, nice to meet you for the first time. I'm going to shake your hand before this is all done. But thank you all so much for attending today. This was such an important and exciting announcement. All speakers will be available to the media for individual remarks as they are available at this time. Thank you so much. And this concludes our celebration program.